I never dreamed this nightmare was going to happen.
I'd like to get my life back.
And it's all from just one little bug.
Lyme is an infectious disease carried by a black-legged tick, commonly known as a deer tick.
The nymphs are coming up in early part of May, and they're very active, and they're fairly aggressive, and they're tiny, tiny, tiny.
Those who have been bitten sometimes develop a bullseye rash, or in most cases, flu-like symptoms.
And then when it is feeding, you don't know it's there.
Dr. Roger Hansen says if Lyme goes untreated or is misdiagnosed, there can be serious side effects.
It can potentially be fatal. It can affect the signals of the heart, but that's not very common. Most people, it's extreme fatigue, fogginess, and their joints hurt, and they feel like they have the flu and it just won't go away.
I don't talk about it a lot. I try to stay upbeat.
Back in September, 32-year-old Oscar Boring from Seward was in the woods with his kids when a tick bit him. He noticed a bullseye rash on his back and immediately went to the doctor. He says he was treated for Lyme and given antibiotics.
After I stopped taking the doxy, I had some pain in my hip, so I thought maybe I'd just tweak something, pinch the nerve.
On October 29th, everything changed.
Going to the emergency room, with a leg swelling up, they automatically think drug addict, heroin overdose. I told them, I said, I don't have nothing in my system. I've never stuck myself with anything. They just said they weren't having it.
Boring says the doctors treated him for an overdose and blood clot. Then they finally came to the conclusion that it was Lyme disease.
I went into complete kidney failure, respiratory failure, heart failure, and that's when they put me on the vent.
Boring was put in a coma for 6 days, only to wake up to his worst nightmare.
When I opened my eyes out of that surgery, the doctor said, "Mr. Boring, I'm sorry to tell you this, but we're going to have to amputate your leg." It's not something that I can accept at that time. Not even for me so much as my kids. I can't interact with them the way that I used to. I won't be able to play football with my son.
Boring says he never thought his life would result to this.
They saved my life. I'm not taking anything away from, the doctors that saved my life, but, had a little bit more been done at early stages, maybe I could still have my leg.
According to LymeDisease.org, there are many reasons why someone who actually has Lyme may have a negative test result. There may not have been time for antibodies to develop, the immune system may be suppressed, or the person may be infected with a strain the test doesn't measure.
And then the organism itself is very smart, and it does things to mask itself and make it very hard to detect.
According to the Center for Disease Control and Prevention, the number of Lyme disease cases has tripled in the United States over the past 2 decades. Pennsylvania has the highest number nationally. Even a study by the state's DEP says there's a high risk of the illness in every county across the Commonwealth.
I can't lift them. My hands, my fingers.
Jerry Beisinger from Altoona is currently in a rehab center, fighting for his life back after contracting Lyme in October.
I was down in physical therapy here about a week ago. And I told him down there, I says, I get so frustrated, I just want to throw something. Except I can't throw anything because my arms, they don't work.
Beisinger says he was an active man, but is now struggling to get back on his feet.
Our life has totally did a 180. It has totally changed. He hasn't been home for 5 months. I really miss him.
While in the hospital, his wife Diane says all signs pointed towards Lyme, but says the doctors would not treat him for the disease.
They did not treat him for Lyme, and we kept telling him he needed the antibiotics. We kept telling the doctors. And they wouldn't listen to us because the test kept coming back negative.
Jerry was discharged, then 8 days later rushed to a different hospital where he says he finally got treated for Lyme. But one small bite led to one big bill.
When this is all said and done, I'm looking at $200,000 in bills. It's very expensive. This whole thing has been it's a nightmare. Not only physically is he suffering, but financially also.
Paying for the medical treatments varies from insurance company to insurance company because it's a chronic illness. The treatments can be very long term. Even a Senate and House bill were introduced in Pennsylvania to help those affected by the disease to get proper coverage.
We need to be able to provide treatment for anyone that needs treatment, and if that's longer term, we need to cover that.
Senator Wayne Langerholtz is a co-sponsor of Senate Bill 100 and says it is currently under review by the committee. A bill he says can help patients focus on what's most important.
Get back on my feet, be with my family.
There are some basic steps that doctors say can help you and your family from ticks and Lyme disease. They suggest wearing light-colored clothing to better see any ticks that attach to you, and then to tuck in that clothing. Now, if you believe you've been bitten, get checked out. The sooner, the better. And as for pets, veterinarians say it's crucial to get them vaccinated for Lyme disease. Symptoms are similar to humans, including loss of appetite, swelling joints, and fever. If your pet shows those symptoms, go to the vet right away. Jillian Hartmann, 6 News.